Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 11th video of repeat revision course of Periodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about mechanical plaque control. In 12th videos after this video we will discuss about chemical plaque control. Now in mechanical plaque control we will discuss about soft nylon brush and power toothbrush and tongue scraper and interdental aids like floss, toothpicks and interdental brush and different brushing techniques which is very important in last NLE exam. Phones method and Bass methods MCQs was come. Now we will discuss all these in detail. Now first we start from mechanical plaque control. In mechanical plaque control, the importance of plaque control, what are the importance of plaque control? Plaque must be removed to reduce inflammation of gingiva, bleeding, bad odor and caries, because in plaque there is a bacteria which are responsible for caries by producing acids. There is no relationship between design of toothbrush and its ability to reduce inflammation and bleeding. Means there is no such design shape of toothbrush which reduce inflammation and bleeding. Now in mechanical plaque control, we divide mechanical plaque control into number one is the toothbrush and second is the interproximal cleaning aids, or also known as interdental cleaning aids, mean the area between two teeth. Now first in mechanical plaque control is the brushes, in which again we divide the brushes into two types, soft nylon brush and power tooth brush. Mean in mechanical plaque control we divide the mechanical plaque control into toothbrushes and interdental aids. Then in toothbrushes there are two types of brushes. One is a soft nylon brush which we use mostly, and next is a power toothbrush which is actually electrical driven. And next is the interdental aids or interproximal cleaning aids. And then in interproximal cleaning aids there are three types of, again divided into three types, flossing, toothpicks and interdental brushes. Now come to the detail. First is a soft nylon brush. This is a soft nylon brush. Soft nylon brush is more effective in cleaning the cervical area, less traumatic to the gingival tissue due to its soft nature, can be directed into interproximal region, less chances of causing gingival recession and abrasion, perfect for areas of gingivitis, necrotizing gingivitis or after perio surgery. And toothbrush should be replaced every 2 to 3 months before filaments fray. Brush should be kept in open air apart from contacting other brushes. This is about soft nylon brush. Next is the power toothbrushes. These are electrical driven and are used for handicapped patient and also for ortho patient. And mostly in handicapped patient, the caregivers use this to clean the teeth of handicapped patients. These are the power toothbrushes for children, mental and physical disability patient with fixed ortho appliances. And next is the hospitalized patient who need their teeth to be cleaned by caregivers. And the targeted hygiene is focus on interproximal and cervical areas while brushing. Mean our target will be focus on interproximal and cervical areas while brushing. Next part, tongue cleaning, we use tongue scraper. What is tongue scraper? This is the tongue scraper. With the help of this, look at the picture, we scrape the tongue to clean the tongue. And also we can use soft nylon brush for tongue cleaning. Now come to the interproximal cleaning aids, or interproximal or interdental cleaning. In interproximal aids, there are three types. Number one is the flossing. Look at this diagram, flossing. With the help of this floss, we clean the interdental areas. Now, flossing, so for floss, use bridges and enlarge diastemas. Super floss under bridges and enlarge diastemas. We use floss should be inserted in oblique manner. Remember, not in horizontal manner, in oblique manner. If we inserting it horizontally, increase the risk of damaging the interdental papilla. Insert the floss slowly and do not snap through the contact area. The floss should curve around the teeth in C shape. We should curve, do not move in and out through the contact area. For patient with poor manual dexterity or caregivers, hold floss in a floss holder. If a patient are handicapped or caregivers clean the interdental area, then hold floss in a floss holder. Now look at this diagram, how floss is held in a floss holder. This is the floss and this is the floss holder. Hold the floss in a holder by caregivers. Now come to the next. Next is the toothpicks. These are the toothpicks. Brush picks for interdental. These are the interdental toothpicks. Gently and easily clean between teeth. These are the toothpicks, and these are like small brushes, but these are small. An interdental brush is large. Now, toothpicks used to run along the gingival margin and into the interproximal areas. Next is the interdental brushes, also used under bridges, in furcation areas and distal surface of last molar. Diameter of the brush should be larger. Diameter of the brush should be larger than the interdental space in order to clean it. These are the interdental brush. And how use interdental brush? This is a usage method. After that, now come to the brushing techniques, which are very, very important. Now in this table there is a brushing techniques, and it's the name of brushing technique and its complete technique and its indication. The first method is the bath method, and at the end I will tell about mnemonic for this brushing technique, how to remember easily for MCQs. First technique is the bath technique, and in bath technique we place the bristles at the 45 angle. Look at this diagram, to the gingival crevice. In bath method, bristles are at 45 angle to the long axis of the tooth, bristles inside the sulcus, and vibrate back and forth, mean forward and backward with short stroke. And this MCQs was come in last June NLE attempt of the dental anally, the MCQs was given bristles are 845 to the long axis of the tooth. Bristles inside the sulcus vibrate back and forth with short stroke. Which type of method? This is a Bass method. And pressure should be firm enough to blanch the gingiva. And next is the modified Bass. What is the difference between modified Bass and Bass method? In Bass method, we place the bristles at 45 angle long axis to the tooth and bristles inside the sulcus and vibrate back and forth, not occlusal and incisal. When we add occlusal and incisal movement, then this is known as modified Bass. After the vibrating motion is completed in sulcus, sweep the bristles toward the incisal and occlusal surface. This is the modified Bass method. Meaning in modified Bass, the occlusal and incisal motion are additional. Now, what are limitation? A 45 degree is hard to visualize, require manual dexterity. Patient might do it vigorously, damage the gingival margin. Now come to the indication. In indication, it's most effective in cleaning sulcus, cervical third, and gingival margin. Mean for cleaning of sulcus, gingival sulcus, and cervical 1/3 up to and gingival margin, we use Bass method. Next is suitable for everyone. For everyone we can use Bass method, but mostly for patient with periodontal disease. Now, what are the indication of Bass method? In cleaning of gingival sulcus, cervical 1/3, and gingival margin, and for patient with periodontal diseases. Next, come to the after Bass and modified Bass. Now come to the rolling stroke. This is the rolling stroke, the roll method or rolling stroke. In the rolling stroke, actually we place the bristles apically and the plastic part of the side of the brush with the teeth. Here, direct the filaments toward the root of the tooth. Place side of the brush on the gingiva and have the plastic part of the brush even with the tooth. This is a roll method, also known as rolling stroke. Direct filaments apically. Place side of the brush on the attached gingiva, plastic portion on the occlusal plane level. Press to flex the filament. Roll the brush toward. Then we roll the brush. How we roll the brush? Toward occlusal and incisal surface while rotating the wrist. Our hand wrist, we rotate the hand wrist and roll the brush toward occlusal and incisal surface. What are the indication of rolling stroke? Children with healthy gingiva, we use rolling stroke, and in combination with the Bass, Charter or Stillman method. Next is the modified Stillman method. What is modified Stillman method? Here again, in modified Stillman method, it is like Bass method, but what are the difference? In modified Stillman method, again we keep the brush at 45 angle, but we do not place bristle inside the gingival crevice or sulcus. We direct the filaments apically and place the side of the brush on attached gingiva. And next thing is the we give a rotary motion, vibration, but in Bass method we give back and forth. But here we give rotary motion and rolling toward incisal and occlusal surface. This is a modified Stillman. Look at this diagram. This is the modified Stillman. In modified Stillman, look at the bristles are on the attach gingiva, not at the gingival crevice. And we give vibratory motion, not back and forth motion. In Bass method, the bristles are at 45 angle into the gingival sulcus, but here the bristles at 45 angle, but on the attached gingiva. What are the difference between modified Stillman and Bass? The first thing, in Bass, bristles are at 45, but in gingival crevice, look at diagram. But here in modified Stillman, the bristles at 45, but on attached gingiva. Next, in Bass method, we give back and forth motion, but in modified Stillman, we give rotary motion and rolling toward incisal and occlusal surface. What are the indication? For patient with gingival recession, we use modified Stillman method. Why for gingival recession? Because we place the bristle or attached gingiva to stimulate the gingiva to regain their form, to redevelop and to heal the gingival recession. And next, for massage of the we do the massage of the gingiva in order to stimulate the gingiva to for regrowth. Next is the charter method. Here, charter method is the opposite of the modified Stillman method. In modified Stillman method, we place the bristle apically and the plastic part, the head of the brush occlusally, but in charter is the opposite. The filament is toward the bristle, the filament bristles is toward occlusally, and the head and the plastic part is apically. Direct filament 45 toward the occlusal at gingival margin, force the filament interproximally and do rotary movement. What are the limitation? Brush ends do not engage the sulcus. Limitation: brush ends do not engage the sulcus plus require manual dexterity. Because the brush ends do not engage the sulcus. Why? Because there is a plastic part. Now come to the indication. Charter method are effectively clean interdentally area. Patient with ortho or fixed praso, we use charter method, and immediately after perio surgery, after periodontal surgery, we prescribe charter method. Next is the very important method is the Fons technique or circular method. Fons technique or circular method. This is the method which are used in child patient. In children, we use Fons technique or circular method. In Fons technique or circular method, a tooth brushing technique in which with the teeth occluded, the child will occlude the teeth and with the brush at more or less right angle to the teeth. Brush will be at 90 degree to the teeth. Large sweeping scrubbing circle are described with the jaw parted. The palatal and lingual surface of the teeth are scrubbed using smart circle. Occlusal surface are brushed in an anterior posterior direction. This circular method and Fons method, where brush is placed right angle to the teeth and gives circular motion when teeth in the occluded position, closed position. This is known as Fons technique, and these are used in children. This is very important. This is the Fons method, also known as circular or scrub method and Fons method. Next is this is the occlusal brushing. At the end of each procedure, we should do occlusal brushing. Now in for all method, an occlusal surface short back and forth stroke will with light pressure, so the bristle clean the fissure and groove effectively. Excessive pressure will curve the filament and they would not clean the pits and fissure. Make sure to clean the palatal and lingual surfaces. Now this is all about the techniques, brushing techniques. Now come to the mnemonic, how we remember this technique, because these are very very important for exam. Now remember, the first is the boss. Remember, in boss spelling there is a S for sulcus, S for sulcus, you remember. Next is the in every department the boss is for everyone boss, because everyone should follow the boss. Next is the boss is suitable for everyone. And next, if our relation is not good with boss, in the result there will be disease. This boss will be contagious for us, therefore known as it is for periodontal disease. Mean the boss method is for sulcus, cervical 1/3 and gingival margin, and for everyone and for periodontal disease. Next is the rolling stroke. And rolling stroke, when we use the roll method, and mostly the children like the rolls, they eat roll. Mean for children with healthy gingiva. When children are healthy, they eat rolls. They like the chicken rolls. Next is the phones method. When in exam MCQs come per children, which is the best method? The best method is the phones method or circular phones technique or circular technique. Now how we remember by mnemonic? In our home, mostly the mobile are in our home children are most likely take the mobile, because they like mobile more as compared to the adult. And when we try to call, when we try to charge the mobile, every time the children take the mobile and start YouTube cartoon videos, because phones phones mean like phones, because children like the phone. You should remember by phones technique. And every time when in exam MCQs come, the best method for children to the brushing technique is the phones method. Next method is the modified Stillman method. And modified Stillman method is for gingival recession and massage. For massage of gingiva, and the result there will be regrowth of gingiva. And how we remember? Here is the men at the end. Men. Mostly when we travel, mostly the men come and say, and they carry a massage oil and say, are you wish to massage? Because mostly men doing massage, remember by still men massage. And massage of gingiva, and the result there will be regrowth of gingiva, and there will be the gingival recession will be decreased. Still men mean massage. Next is a charter method. How we remember charter method? Whenever we go in perio department Praso department, ortho department. In this department, mostly there are charts. In Praso there are charts like crown and bridge charts. In ortho there is a brackets, braces, clear path aligner charts. In perio there is a minor of the sursor, major of the sursor, mostly white and red lesion charts. Now charter method chart. Charter method is per patient of ortho, prasto and perio. These are the methods you can remember by this simple mnemonic. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.